Thank you, Bill. That is, those are very kind words. I always feel a little bit smaller, which, not my stature, of course, but I feel a little bit smaller whenever Bill talks about what I've done, because it's really about what he has done that makes Less Cancer so successful, our foundation. First of all, I'm a gastroenterologist, and I saw that at the beginning there were people standing in line for food, and Bill told everybody to sit down, and very dutifully everybody sat down. So if you are hungry and you didn't get any food, please serve your stomach and your brain and help yourself. And I tend to talk a little bit loud, so you'll still be able to hear me. What I wanted to talk about, and what Bill was talking about, is really a natural segue, and it's also what Representative Comstock was talking about, which is the amazing part of the cancer prevention story is that we don't have the kind of resources that they have for the cure. We don't have the kind of resources that are there for actually some of the things that we know we should stop to prevent cancer. So the resources are out there, but they're not focused on prevention. So what has struck me, and this is the group of leaders that I want to talk about, is it's almost been by accident that some of the greatest steps in prevention have occurred. And how many of you are medical students? How many of you are going into medicine or want to go into medicine? I'm looking over here because I think this is the younger generation. But anyway, so when I was a medical student, there was nothing on prevention. And I won't tell you how long ago it was. It was a while. That has all changed. And that has changed because of the work of people who happened to just notice something. So let me talk a little bit about this. Traditionally, prevention has not been taught in medical school. It has not been a major focus of doctor visits, and it has certainly not been the focus of popular marketing, where we have been inundated with messages of smoke more, drink more, and, of course, eat more. In this kind of environment, the champions of cancer prevention have historically been individuals who have just, in many cases, just by chance, sort of right place, right time, been confronted with a problem, noticed subtle but meaningful connections, and recognized an opportunity to advocate for the health of their community. This is the single most important point I'll make. And I've been told when you give a talk, you really only want to focus on one thing because that's all we can remember. So especially for the young people here, if you notice something and you say, hold it, let me start making connections, let me just do that little extra thought piece, maybe you can change the world. So let me give you some examples of people who've done that, and they're right here, by the way, some of them. In 1998, a young corporate lawyer named Rob Bilott, where's Rob? Right there, still young, received a call. He worked in Ohio. He received a call from a West Virginia farmer asking for help. This is an incredible story. The farmer believed that his livestock had become sick because his farm was contaminated from runoff of a neighboring landfill just above his farm that was owned by DuPont. So the farmer picked Rob. Here's the incredible connection. Because as a child, Rob had stayed with his neighbor, as a child, when Rob was this high, visiting his grandmother who lived in the area, and that neighbor remembered that Rob had become a lawyer. None of the lawyers in the community would take this case. But when Rob saw all of what was going on, he made that connection. It was not really his field, although you had some background in this. But in 2016, Sunday New York Times Magazine did a whole spread on Rob's work. It's worth reading. It reads like an amazing novel, but it's real. And so Rob subpoenaed or obtained a court order for DuPont's records. He stumbled, in the New York Times article, I'll quote this, Bilott stumbled upon a letter DuPont had sent to the EPA that mentioned a substance at the landfill with a cryptic name, and hopefully most of you will recognize this name now, pfoa. I started seeing a story, Bilott said. I may have been the first one to actually go through all the records. It became apparent what was going on. They had known for a long time that stuff was bad. Rob's subsequent work funded the C8 study. The C8 study looked at 70,000 people. If you're a scientist, you know that's a pretty strong, that study will have a lot of power, 70,000 people in your study. And they demonstrated a connection between what are known as PFCs or PFAS, which is a chemical type, and diseases including at least 3 types of cancer. Now these chemicals, for those of you who are old enough to remember what Teflon is, these are the smoothing agents for Teflon. These are also in conditioners. They're also in your car washes, if you go through a car wash. And they're also in Glide Floss, if you floss your teeth. The same study has been used as a standard for monitoring infected residents in an effort to prevent cancers in the future. Another story, 2014, in my own backyard, a mother of 2 boys and fellow resident of Rye, New Hampshire, Mindy Mesmer, reported her concern to the New Hampshire Department of Health and Human Services about an unusually high number of children in the community being diagnosed with cancers. There were 2 different kinds of cancers. There was rhabdomyosarcoma and pleuropulmonary blastoma. So Mindy asked the Department of Health and Human Services to do an investigation, and for the first time, the investigation showed that this met the CDC criteria for a cancer cluster. What a cancer cluster is an incidence of cancer that exceeds what would be expected in that neighborhood. Now here we go with the making connections. In our neighborhood was an Air Force base called Pease Air Force Base. At Pease, they'd use firefighting foam. Guess what the chemical was in the firefighting foam? PFCs, right? Remember that back to Rob? So PFCs are a major component, or were a major component in firefighting foam. Where does firefighting foam go? It runs off. So it ran off into the Pease well system for public wells. Pease was decommissioned, became a major business hub, had child care facilities on there, and as well as all of these businesses. To date, at least 1,500 people have now tested positive for significant levels of PFCs in their blood, all from one well. Guess where the waste from Pease went? The waste went into a Superfund site called Coakley Landfill that sits right in the middle of this 5-town area where the cancer cluster was identified. So I'm sitting in a meeting with the EPA, our Department of Environmental Services, and several other government officials, and I was a state representative at the time, and I said, wait a second, here's your connection. If waste from Pease is going into the Coakley landfill, have you tested that for PFCs? The EPA said no, but maybe we should. So they did test it, and it turns out that not only is the landfill full of PFCs, and the wells that are used for monitoring are testing positive, but some of the private wells nearby and the 2 rivers that start from right behind this landfill have PFCs in them. This is how you start making connections to start preventing cancer, because you start recognizing in your own backyard what is happening. I call it a cascade from this one moment when Mindy called the Department of Health and Human Services and called me as her state representative. At this point, Mindy went on to become a state representative and had 3 bills passed and signed by Governor Sununu that would go on to enhance the safety of our water and also prevent disease in New Hampshire. She's now running for Congress. Governor Hassan formed the Governor's Task Force on the Seacoast Cancer Cluster, which I chaired. And in addition to these efforts, Governor Hassan, who is now Senator Hassan, Senator Shaheen, and our 2 Congress people went ahead and were able to attach to a defense spending bill funding for the government agency called the ATSDR to do a nationwide study of PFOAs and PFCs in Air Force bases across the country. So that study that we all are hoping for, remember, this is science, and we have to have the science to back up concern. That study is going to be done. And it all started with Mindy. This has been the traditional norm for cancer prevention, individual efforts to respond to observed threats to human health. This is how Bill Cousins came to found Less Cancer, which for more than a decade, actually 14 years now, has spawned a tsunami of intervention by groups and individuals to raise the awareness and inspire the daily practice of cancer prevention. In Warrenton, Virginia, at the Highland School, and unfortunately they had to cancel being here because of the weather, students attending a past Cancer Prevention Day workshop started Tan Less, Shine More. That's a program educating high schoolers about the dangers of excessive sun exposure in tanning beds. At the state level, when I was a state representative, I partnered with my Republican colleague, John Fothergill, who is a physician from the North Country. We went door to door to the Senate offices, and we now have a bill that bans tanning beds for minors. You met Congressman Charlie Dent. He led the successful charge against tanning beds, resulting in the FDA classifying them as carcinogenic. With so many resources stacked against the common sense cost-saving cause of cancer prevention, it is no wonder that efforts to date have largely been smaller scale and reactive. But as Congresswoman Comstock said, this is changing. We're seeing the resources starting to shift toward prevention. And with the prevention pioneers like Graham Colditz, who is a former speaker and is a part of our Science Advisory Council, he was a principal investigator at the Nurses' Health Study, which was based at Harvard and looked at outcomes of 121,000 American women. Good science is now coming together to show that we can prevent cancer by focusing on smoking cessation, exercise, decreased alcohol intake, better diets, vaccinations, human papillomavirus or HPV, hepatitis B virus, HBV, access to health care, genetic testing, and screening. I'd like to put in a little plug for the access to health care. People who do not have health coverage are diagnosed later in the disease process. Their mortality is as high as 40% higher than people who have health coverage. So especially as we think of this debate in Washington, we need to understand just having coverage, having access, can save lives. The emotional return is obvious. Imagine a greater than 50% decreased incidence of cancer by implementing what we currently know will prevent it in the first place. From a purely cost-saving standpoint, the return on investment in prevention would wow even the strongest fiscal conservative. While we know that prevention can work just by looking at the example of the sharp decrease in smoking rates over the last 50 years, in a 2012 study in Massachusetts, a program on smoking cessation actually reported an over 200% return on the investment. So $1 of taxpayer money towards smoking cessation in this one program resulted in $3 of savings, or the return was $3. That's a significant amount of money. Imagine if you take the total cost of cancer in the United States, which is $87 billion a year, at least, and applied those savings to it. Prevention is not just a good idea. It's not just a way to never get cancer in the first place, but it is also the single most effective fiscal intervention we can ask for from Congress. So while we're on the threshold of a nationwide understanding of the critical role of cancer prevention, we will never be beyond the need for prevention heroes like Rob and Mindy and Susie. They have recognized a problem as an opportunity. And this is what I really want, this is that one point I want you to take home. If you look around your neighborhood, look around your home, look under your sink, every intervention you make to prevent cancer, to decrease risk, is an opportunity to save a life. So if you translate that opportunity into meaningful action, advocate for the health of your community, That will continue to serve as the foundation for cancer prevention, especially as we launch forward on this new threshold of culture change in the country, focusing on prevention while understanding we need a cure, but wouldn't it be nice if you didn't have cancer in the first place? So to all of you gathered here today and to those watching around the world, I'd ask you to look inward, look around you, ask yourself, what is your opportunity? What will be your action? How will you intervene to prevent cancer and advocate for the health of your community? And in so doing, like so many of the people here, the leaders here, you may end up changing the world. Thank you so much.